Everyone, I am Dr. Hugh Nguyen. I am an urgent care physician at the Westmore location. And so I've made a few videos to help you guys with ECW. I recently started with Norman Regional, and during the onboarding process, they had me shadow a handful of physicians and other providers. And it seemed like everybody was using ECW differently, and there was not a standard way for everybody to use it, but there was a similar complaint was that everybody thought that ECW was very cumbersome, and it made it very tough to do their job. And so I spent some time teaching myself how to use ECW. And since then, I've been showing a lot of the providers and doing some short trainings on how to improve their efficiency with ECW. I've had a lot of positive feedback from the education that I've provided, and so I wanted to make some videos so I can share this with more providers who may not have time to come to my clinic to get some training, or I may not have time to come to you to give you training. It's also beneficial for the people who I've already trained and want to review and look back at some of the things that we discussed that they may not remember in just one visit. And so let's get started. So to get started, I have a few settings I'd like you guys to change. Um, so first off, some of you may or may not use the M-Modal software. I personally, I use it a lot in my documentation, and there's a setting that's really helped me. If you click on your the floating M-Modal setting here, you click your name, and then go down to device button mappings, and under the second heading here, click the standard button, and there's a setting down here that you want to change from toggle to talk to hold to talk, and then hit save. And what this does is that if you look at your keyboard, you'll see a little tilde symbol in the top left corner. That's the squiggly line. So with that setting change, whenever you hit that button and hold it, it turns the microphone on. And so you can speak into it and it will dictate. When you let go, it stops. And the nice thing about this is that sometimes when you're dictating, you don't have to hold the microphone device, so it frees up your hand to use your mouse. It also allows you to use it on your phone if you use your phone as a microphone as well. So some of you at home use your microphone, use your phone as your microphone, and if you click the squiggly line or the tilde, it will actually turn it on and off, and lets you dictate more easily that way. All right. The second setting that I'd like you to change, and so let's open up ECW. And so before we get started, if you look here at the way this HPI, it's so this HPI, I made it using structured data, and that's just the way that a lot of the text and text documentation in ECW is created in structured data, and so if you look here, it looks very hard to read because it's just in a paragraph format. And one of the settings that it would be useful to change is to go to your hamburger here and go to menu, and then when you go to your menu, you'll see settings, my settings, and then on the left, go down to user settings and scroll down all the way. And you'll see this section right here that says default style for structured data elements in progress notes. And so the setting, a lot of you guys will have the setting as default, but I want you to change it to new line and then hit OK. It's going to have you log in again to make your changes take effect. You can actually just go down to this refresh button down here, and it looks like a semicircle with an arrow, and click on that. And if you'll notice, it makes the structured data look like this. And so every new element gets a new line. And it makes it a lot easier to read for you, for the billers, and for your nurses as well. And so it makes the data more useful on a note. So now that we've got some of the settings out of the way, I'd like to give you guys a quick introduction into order sets. And order sets are, I think, one of the most powerful tools in ECW and one of the things that can make documentation a lot easier and putting in orders and everything a lot easier, but it's often overlooked and nobody shows anybody how to use it. And so let me give you guys an introduction here. And so to get to order sets, it's over here under the OS. And these are my favorites and a lot of the ones that I've made myself or if I've made while I'm training some of you guys. And I know a lot of you guys are primary care. And so let's start with a primary care one. Let's do hypertension. And so you click on this, and first thing it pops up is a list of problems or diagnoses. And you can also link diagnoses to these order sets, and I can show you that later, but I've linked hypertension, uncontrolled hypertension, and borderline. And basically, what this does is it allows me to pick a diagnosis if I don't already have one, to put all the orders I'm going to place and to link it to that one. You can also select one of the diagnoses that are part of the problem list that the patient already has. And so in this patient, let's do since they already have benign essential hypertension, I'm going to click that one and then you hit OK. You don't want to hit add diagnosis only yet because that just adds the diagnosis and doesn't let you order anything. And so hit OK and don't worry about that. Um, and so it'll take you to this window. And so this is basically an order set. These are orders that I have manually added and that may be something that some of you guys in primary care may use for somebody with hypertension. So it includes amlodipine, losartan, metoprolol, HCTZ, lisinopril, chlorthalidone, and the strength, the frequency, duration, dispense, and refills are already selected in here for you. So you don't have to go and manually enter them. And if we scroll down some, it also includes labs. And so UA, microalbumin, CMP, CBC, lipid profile, and these with the and these right here with the F, those are future orders. And so you can even put future orders in here. So say you have a patient who presents with hypertension and you want to order for them, let's start them on lisinopril 10 milligrams daily. And then you also want to get a urine microalbumin, CBC, CBMP, CBC, and then lipid profile. But you also want them to come back in 6 months. And you'll put in future orders for lipid, CBC, and CMP. And you want them to come back in 6 months. And so we'll change this to 6. And what this means is these are future orders for 6 months so that they can go get those labs drawn before they come and follow up with you. And you can even add diagnostic imaging. And so if you wanted them to get a chest X-ray, you can have them do that. Um, and like we were talking about earlier, you can add in a 6-month follow-up in there. And then maybe you want to refer them to cardiology as well. And so you can even put note elements in here. So under your treatment plan, you can add specific things. And so I want them to have this in the treatment, and then let's talk about the DASH diet. And these are just examples. You guys can put whatever you want when you learn how to create and make these template or these order sets. And so after you've selected everything on your menu, and so on your order set, you want to select order selected right here. Don't hit order because it'll only order in that specific area, and don't hit close. You really should only hit order selected no matter what in here. So let's hit order selected. You may notice nothing happened. So sometimes you have to hit the refresh button down here on the bottom right hand corner. And what that did is it added the benign essential hypertension as one of your assessments. And then it linked all of these labs that we put in here, and even the chest x-ray, CBC, CMP, the lipids, future orders, and then your notes for that patient, and then even a referral to cardiology. It doesn't specify where it goes, so you'll still have to open it, and if you want to specify who it goes to, you can, or you can just let your nurse or whoever your coordinator do it if you leave it blank. And you see how in our follow-up, that's already there. And since we did the chest x-ray, there's a procedure code for the chest x-ray. And so really, you just need the HPI physical exam and your visit code. And so that's kind of what an order set is useful for. And so let me clear this out and I'll show you another one that is a little bit more complicated on how you would use it for an annual wellness visit. I'm just deleting all of the orders we just placed so that we can start with a blank slate here. Okay, so here's our blanket new statement, a new patient. We'll go back to the order sets, and this time I want to use one of my preventative visit ones. Um, so we'll click on this one. So if you see all of the linked assessments I've made right here, it goes to all of the screening stuff that you may need to screening diagnoses that you may need for your annual well visit. There's quite a few of them. Um, but to start, what we should do is only pick one assessment. And so this is the encounter for preventative care. So we'll click on that and hit OK. And so same thing with like before, it pulls up this menu that we've created for ourselves. Um, and so based on what you may want, it has lipid, CBC, CMP. You can have a Cologuard, PSA screen if you wanted, HIV, hepatitis, A1C here. And let's say for this one, I want a Cologuard. And if you're a smoker, you want a lung screen. Somebody who may need a mammography and a DEXA scan. You also want to do their pneumococcal vaccines, or let's say Zostavax. And then you want them to follow up in a year for their annual wellness visit. And if they are on opioids, you can open this and then just print it out and just give it to them so you don't have to go and dig for, paperwork or instructions. Um, and so, and these are some of the headings that I've made, but these are just for demonstration purposes. You can create and add whatever you want later on. And so let's hit order selected. The orders have been placed. And again, just out of habit, I click refresh just to make sure that everything came through. And so it added an encounter for preventative care and the need for zoster vaccine already. And so now you have all of these things, but you probably need to link more diagnoses to them and then organize it. And so now we want to add the other diagnoses. So let's go back in. We'll go to our same order set. Mine's under Medicare wellness visit, annual wellness. But remember these that we saw earlier, these linked assessments? And so in that patient, we did, um, let's see, we did a lung screening, DEXA, HOMO. So that one, we did screening for diabetes, colon cancer with the Cologuard, need for shingles vaccine. That one's already in there, so we don't need that. We did a DEXA, so screening for osteoporosis, screening for lipid disorders and metabolic disorders, and we did a screening for lung cancer as well. And so at this point, we've clicked all of those, so we have to do add diagnosis only. And all that does is add all of these diagnoses. And we still have a problem that they're not linked together. And so this is a part that can be very time consuming, but there's a trick that I found. And so you go to treatment, click on the orange treatment text. It'll take you into this treatment window. And so here, it's pretty daunting with how many different diagnoses and different things that we've ordered. But there's the trick that I have is if you go to the send area right here, don't click it, click on the caret that goes up and then go to order details. And this takes you into this matrix where you can associate your diagnosis much, much more easily. So let's see, this one is for malignant neoplasm of the breast. And so we'll just go down to here, diabetes, we got CMP, A1C, colon, we'll do Cologuard, osteoporosis, we'll do your DEXA, for lipids, we'll do here, zoster. We don't have that here, but that's associated with the immunizations. This one's metabolic disorder. So here, lung cancer, we can do lung, and then you hit OK. And so all of that is done. And it's still in the preventative care if you want it there, but um, it's linked to the appropriate diagnoses now. And so just a reminder, it's over here in the caret under order details. Okay. And so and that's how to use an order set. And the next thing I want to show you is how to copy order sets over. And so if we go to menu, I always go to the search bar and type in order set administration. And if you click here, there's a bunch of different ones that have already been made by people. And so let's find one that we may like. And so you're welcome to use mine. My initials are HCN. And so say you want to copy my diabetes one. And so you look at it and you see there's a lot of things that you may like, things that you don't like, and that's fine. You hit copy, and then you change this to your initials. I typically like to use your initials, so I'll do this as a testing right there, and you hit OK. Don't worry about these, you don't want to change it. Sometimes it messes up, and so you might have to do it again. and hit OK. And you see here it says order set copied successfully, and then this right here shows the new name. Make sure you hit that star to favorite it so that it will show up on this side right here. And so you're currently in the order set administration, and it gives you this button to add. So here you can add new medications. And so some of you may use favorites, and it makes it a lot easier to add things to the list. And so we already have a lot of medications here that we may use. And so let's do metformin XR. See if it shows. Yes, metformin ER, sorry. Haven't done primary care in a while. And so you'll see this medication. Let's say we want to add the 750, but right here it only says 30 days and dispense 30. You typically don't do that. And so let's hit that pen, and you want to change that to 90 days, 90 tablets with one refill. One refill. And you hit OK. This is gonna pop up because it thinks that you're actually ordering the medication and there's a duplicate, but you're really just adding it into the order set. So hit yes. And if you look down here, what we just added is down there. And let's say we also want to add the 500. And so you go in there, same thing, 90, one refill, hit OK. Hit yes. Be careful here because it has stars where you can add it to your favorites, and you may want to add these to your favorites, but there's a bug when you hit here that it will freeze up the system and kick you out. And so don't click these. And so we added those two, but say you didn't like them there, you can actually remove them and just delete them. Delete anything that you don't want to use or don't like to use. But you can add whatever you want and then hit OK. And so that's what's on your menu here. You can do labs as well. And so for labs, you just add, and it looks just like the order page for you to add labs. And so same for future orders, you can add future labs here. This F here is for fasting, and this here is for stat. And so we already have lipid orders in there, but you can pick a different one if you want, or you can use that one. Same for diagnostic imaging. It just looks just like when you order imaging. Another setting that I think is useful to have, but you actually can't change it here, but just make sure that you have this under contains and either in-house or send out based on what kind of imaging you guys have or prefer. And then you can add whatever follow-up you want. So you can free text here if you want as well. And you can add immunizations, any injections you want to use. And injection is in-clinic administered medications, referrals, patient education. So you can actually add those PDFs. And I don't know if you remember earlier when I pulled up an opioid education PDF. This is where you add it. And so if you have PDF of something, you can add it there, and it makes it easy to access later. You can even add web links, so URLs. And then these are messages that go to the patient portal. And then earlier I showed you some notes that we had a selection of. And so this is one of the notes here. If you want to add a new one, you can just hit add notes and you'll do note two, blah, blah, and then hit save note, and that will add it to your list. And so after you're done, just you can hit the X up here and then hit the refresh button. And so let's see if it popped up over there. So under order sets, I believe it's under my initial testing diabetes. So you can open it. So this is an important thing. You see how all of these are clicked? It's very important that you undo all of them. So you click here to clear them out. And the reason we do that is if it's on here and it's clicked under the PL, which is stand for problem list, if you hit OK and all of those are clicked, it will add all of them to the problem list. And so you don't want to do that. So just it's because the system thinks that you're actually adding them to the patient chart, and it believes that each one of those should be a problemless problem rather than just a diagnosis. Um, it's just a silly thing that ECW has, and so just undo it, and then we won't have any problems. So we have this patient. Let's do the diagnosis: diabetes mellitus type 2, uncontrolled. And then you hit OK. Because it shows all of those things that we have, and including that new note section that I added. And so if you click here and here, it'll add both of those to the treatment note under the diagnosis that you clicked. Okay. And so, and that's how you copy a template. You're welcome to copy any of mine. They're almost all of them are under HCN as the title, and then some of them I will modify to make sure that it's included in there. And I'll be adding more as I go along. So sometimes if you want to look at it, there might be some new ones. So I'm going to go back in there and delete that one since I'm not going to use it. And the reason we copy everything is that if you use somebody else's order set and you change it, it changes it for them too. And so just out of respect and you don't want to mess with anybody's things, uh, just copy it. It's super easy. If you want to make a new order set, you can, and then you just hit new. It'll ask you to name it. Sometimes it does that. So let's try that again. Just again, new order set. Hit OK. And so you'll have a blank slate where you can add whatever you want. And so again, make sure you hit the star button when you copy or make a new one. And if you saw that I had all of those diagnoses that were linked, you have to do that manually. And so this is how you do it. And so you'll see here, there's diagnosis linked. This is where you add it. Don't add a trigger because that triggers for everybody. That means that if you put in, for instance, hypertension in the trigger, anytime somebody puts a diagnosis of hypertension, this will be the order set that pops up as a default. You don't want to do that. So just hit add on the linked. And let's do some test ones. So we'll do hypertension, central hypertension. We'll just do a couple here. So when you add these linked assessments, make sure you add everything you need because there's no way to go back in and remove them, and there's no way to go back in and see what you've added other than to look through your linked assessments. Um, and so it's more important not to add anything that you don't want in there. So you hit OK, and so we'll leave, hit refresh. So HCN new order set, if you click it, you'll see those two diagnoses, the linked assessments that we just added. Again, make sure you unclick those because otherwise they'll go into the order set. And so if you click that, if you click both of them and you hit OK, everything that you order on the next page will be linked to both of them. And so just typically you only want to do one at a time and then hit OK. We didn't have anything in our order set, so it's going to look like this, but that was just for demonstration purposes. All right. And so that was my quick introduction on how to use order sets, how to copy order sets, and how to create your own order sets. But I wanted to show you a couple of quick things. These are some ways that I've learned to use order sets that might be useful. And so I made an order set for my nurse. And if you're welcome to use it if you want, but you can make your own. Mine is named Stat Nurse Updated. I made another one, but I updated it to have more things. And so let me show you. So um, sometimes I like my nurse to put orders in for certain, in-office labs when patients come in. So say they come in with flu-like symptoms or whatever symptoms, they're all linked in here. And so let's do flu-like symptoms. I hit that, I hit OK. And these are all the in-house labs that, I would use or I would let her use. And so let's do influenza, strep, and COVID. I added nebulizer treatments in there. I, and these are all of the in-house medications that we carry. So um, DTaP, Medrol, dexamethasone, Zofran, Toradol. So all of those will be in there. And I even included the school note that I made. Um, and so that it puts everything into one section for her to make it easier. Or if you're in the room and you wanted to add more labs, you click it and you add a couple things. For instance, if somebody came with a UA and you treat them for a urinary tract infection and you wanted to add a urine culture, you can just go in there or you can add it the other way. But hit order selected. And I didn't clear all this out earlier, but it's all in there. Let's refresh and see if it added it. So flu-like symptoms. It's gonna be hard to see all those. But here it is. All right. And so that's the end of this section. I have another video that I'm going to make um, to talk about some shortcuts in documentation, especially with the HPI, the physical exam assessment and treatments and all of that. So everything that's in this section will we'll review in a later video.